How do you tie a surgical knot when suturing? If you find yourself in a situation where you need to close a wound, knowing how to tie a surgical knot is an essential skill. Let's break down the steps to make it easy to understand and follow. First, it is important to know why you are tying a surgical knot. This knot secures the suture material, keeping the edges of the wound together. You want it tight enough to hold but not so tight that it damages the tissue. The most commonly used knot for suturing is the two-hand square knot. This knot is reliable and does not slip, making it perfect for various suture materials like surgical gut, silk, or synthetic threads. Now let's get into the basic technique. Start by holding the needle end of the suture steady with one hand. This part is called the post. With your other hand, take the free end of the suture and wrap it around the post to create a loop. Pull the free end through this loop to form the first throw of the knot. Next, you will want to tighten the knot. Pull both ends of the suture in opposite directions. This should be done evenly and steadily to avoid weakening the material. For the second throw, reverse the direction of the wrap. This alternating motion is key to creating a square knot, which is much more secure than a granny knot that can slip. When tying the knot, use a technique called the pistol grip. Pinch the suture with your thumb and index finger to control the free end. Rotate your hand to wrap the suture around the post finger in one direction for the first throw and in the opposite direction for the second throw. Typically, 2 throws are enough for most sutures. However, depending on the wound and the type of suture, you may need to add more throws to secure the knot firmly. Be cautious of common mistakes. Avoid sawing the suture strands back and forth, as this can weaken the material and cause the knot to break. Always pull the strands evenly and smoothly to ensure the knot lies flat and secure. In a survival situation, mastering the two-hand square knot with whatever suture material you have is vital. Proper knot tying can help reduce the risk of the wound reopening and infection, which can be very serious in remote areas. Practice tying knots with different materials and in various conditions to build your confidence and skill. Remember, tying a surgical knot involves wrapping the free end of the suture around the steady post end in alternating directions to form a secure square knot. This skill is essential in survival first aid, helping you effectively close wounds and promote healing.